Okay, YouTube, one more reaction video. Alright, so tonight I'm making a reaction video to another Jubilee video. And this one is trying to find out who is the real doctor. I guess there's a bunch of fake doctors and a real one. And I'm pretty sure there's probably going to be a bunch of nurses or people in the medical field. So it might be hard. Alright, let me get to it.
We're on call. What was your least favorite thing to be woken up by?
I got a little bit annoyed with the Tylenol call, but you know, I had to do what I had to do, so.
I did have to see a patient for like herpes in his eye, so that wasn't very pleasant.
Five are posers, one is the real deal. In a room full of liars, can these teens find the real deal? So, how are we feeling?
We're feeling good.
Before the video starts, I'm just gonna say that the real doctor, it's either gonna be Asian or a woman. I'm just guessing based on stereotypes. Although, yeah, just because there's a lot of women in the medical field, and there's a lot of Asians in the medical field, mainly Filipino. It's just like I don't know. That's just my experience.
We're feeling good.
Yeah, I'm feeling maybe a little more confident than I should be now that I get a look at you.
They ain't ready. They ain't ready. Okay. Numbers 1 through 6, they're not ordered. Can you tell us your specialties and what school you went to?
I'm a dermatologist and I went to UCI.
I'm a urologist and I went to University of Tennessee.
I'm an emergency doctor and I went to UCF as well.
Physical therapist, Rutgers University.
I'm a pediatrician and I went to Drexel
That dude's too jacked to be a doctor.
University.
I'm an optometrist and I went to Southern California College of Optometry.
Number 6, can you tell me what 20/20 vision means?
Yeah, so basically it's kind of complicated. There's a lot of like physics to it, but there's a certain angle that's subtended by the letters that are on the Snellen chart that you're looking at, and so they standardize that at 20 feet distance. So if you're 20/20, you're seeing what someone should be seeing at 20 feet. But if you're 20/30, what someone can see at 30 feet, you need to be standing at 20 feet in order to see it.
When you guys were on call, what was your least favorite thing to
I don't know if that's true or not. It sounded like it's true, but at the same time, it sounded like she was kind of just winging it.
be woken up by?
During my residency, I actually had a case of Stephen Johnson's, and that was very scary to see.
A large accident with fatality is always a grim
He's not a doctor.
thing to come into, especially if children are
Too nervous.
So that's the worst thing that I've ever had to do.
I got a little bit annoyed with the Tylenol call, but you know, I had to do what I had to do, so.
My emergencies are mainly during like a practice or a real game. I've had ankle injuries that need to be like lowered inflammation.
The other guy, the Asian guy, he doesn't seem like a doctor either. He didn't give any. So for the two ladies, they gave real good details, but everybody else, no.
For ice packs or certain, massage therapy.
I think
Yeah,
seeing any
nothing.
babies in pain and then seeing like a tragic loss is the hardest thing.
I haven't been on call
Yeah, it's gonna be between 1 and 6, my guess.
as much, honestly, but I did have to see a patient for like herpes in his eye, so that wasn't very pleasant.
I think you'd be thinking.
I know,
what I'm
you were
thinking.
thinking what I'm thinking.
I'm thinking what you're thinking. Okay.
Okay.
We're ready to make an elimination.
Each team will try to find the real deal by eliminating
Number 2's gonna go away.
imposters.
He was so
If
bad.
both teams eliminate the same person, they will be removed from the game.
When you ask about why they don't
I
like
told you.
being called at night, it's so sad with the children and this like general thing, I was like, okay, so that's nice, but
How long have you been practicing since, well, you're still in residency, so since out of residency?
I've been out of residency for a little over a year.
I graduated in 1993 and went right into work, so
28.
28.
I graduated medical school at 2021.
I've been practicing for 15 years.
I finished my residency at USC Medical Center 5 years ago.
And I've been out of school for 1 year.
Doctor number 1, I have a question. For the medical terminology, intra versus inter, since you're a dermatologist, what's the difference?
Yeah, so it has been a while since I've been in medical terminology, but I definitely use inter a lot, and that would be inside. And then intra Gosh, I don't remember off the top of my head.
Doctor number 4, can you name me
Oh man, that seems. I'm gonna have to go with number 6 now.
different kinds of cruciate ligaments?
3? Is that 3?
However many there are.
Oh, you have the interior, interior, you have meniscus. Those are the main for knee.
No, it sounds wrong.
Doctor number 3, what system is the lymph nodes a part of?
The lymphatic system.
It sounds like he just made that up too.
Are we allowed to eliminate 2?
No, just one.
Oh damn. Damn. He's gone.
As a reminder, if both teams eliminate the same
Oh, yeah.
person,
He's
that
gone.
person will be removed from the game.
You know what? They probably put an Asian in there to confuse them. Yeah, but they put the wrong Asian.
I asked him to name me the cruciate ligaments, and he answered with,
Meniscus.
which is not a cruciate ligament. As a physical therapist, you should
Yeah.
probably know that.
Doctor number 5, could you tell me a common medication that you prescribe to one of your patients?
Benevate, it's for babies that have fibrosis before they get circumcised. We try that method first. An average is like 50 milligrams.
Doctor number 5, I had a question for you too. For a baby under 28 days, if they had a fever, how much Motrin would you give them?
0.
Ideally none.
Ooh, she knows.
Well, I said 0 too, just and I'm not a medical professional. So I wanna give her a point.
Okay, go ahead.
Doctor number 6,
It just sounded like a trick question.
if the patient had glaucoma, what kind of prescription would you give them?
You give them something called latanoprost. So it's an eye drop. You do that one at nighttime only, in whichever I had the glaucoma.
And then what would be the abbreviation for nighttime only?
QHS.
Yeah, she's the doctor.
Our resident, number 3, can you tell me what a normal blood pressure is and then kind of explain to me what those numbers mean?
120 over 80, and 120 is the systolic, so pretty much the amount of blood that's in the chamber before it's injected, and then the volume number is basically the resting volume.
1 and 4, could you tell me what kind of cars you guys drive?
I drive a Toyota Honda Highlander.
So I have been driving the same car since I was 15. I drive a Honda CR-V. I am still paying off medical school, so I will be driving that until it cannot.
Honestly, I believe that she is in the medical field, but I don't believe she's a doctor.
Be driven anymore.
I think we're ready to make another elimination.
Yep, the jock.
In this round, both teams have decided that one person is definitely not the real deal. Number 4.
If he is a doctor, he's a horrible doctor.
I would love to hear your wackiest story from a patient on the job. Down the line, sorry, I'd love to hear from all of you.
So we had a TikTok star in one time, and when I entered the room, he was standing on the medical bed, filming something, pretending he was surfing. So that was definitely very interesting.
It was a vaginal occlusion. She and her friend had been playing around with a bottle and created a vacuum, therefore lodging the bottle in her vagina.
I had this elderly patient. She had some sundowning, some form of dementia, but she kept asking me to go to the bathroom with her to show her good time.
A mother asked me, is it okay to put false eyelashes on her newborn baby for pictures?
For me, I had a guy come in because he was playing with a Nerf gun, and then I guess he got hit in the eye, and then he ended up having like traumatic uveitis, and then he got some glaucoma as a result from that. So that was pretty crazy.
Like I said, it was gonna be Asian and or female, and she's both. So I'm with number 6.
Nerve or nothing, right?
All right, we're good to eliminate.
Doctor number 2.
Thank you. Bye-bye. So we eliminate number 2 next because there were very broad answers given. It wasn't very like specific to what a urologist actually does.
So this is a question for doctors 3 and 5. You walk into the room and you see the patient's monitor, flatline. You feel their pulse, there's nothing there. How many joules are you?
Hey, I just noticed something. This chick is wearing a stethoscope. Why? Well, I don't know why she's wearing that. This is ridiculous.
You're going to shock.
It's like they always have that on like CNN or Fox News. Every time they have a doctor, that's how you can tell they're a doctor, because they have a stethoscope. If I was one of the contestants, I would have that too, just to mess with them.
Shock them with doctor number 5.
5.
With doctor number 3.
200.
Dr. 1?
It has been a while since I've been in the ER. I am a dermatologist after all, but if I remember correctly, it's 150 joules.
Okay, Dr. 6.
Yeah, so I definitely don't work in the emergency room, so I don't really work with that. I'm not sure.
Okay. That was a question everyone got wrong. The answer is none, because you don't shock asystole. But that's something medical TV sometimes gets wrong. Everybody comes in there with the paddles ready to go.
I don't know who is
I don't know anything.
the real
anymore.
deal at this point.
Okay, I have a question for doctor number 3. So earlier I asked you what system the lymph nodes are a part of. You said the lymphatic system. What's the major system that it's a part of?
I know that it recycles like dead cells, fights off infections and whatnot. I'm just like at the tip of my head. I'm just like nervous right now, so I can't.
Doctor number 1,
They really
do you know what the answer is?
I believe it's the circulatory system.
Doctor number 6, do you agree?
The immune system.
Sweet. Okay.
Doctor number 5, what is the average heartbeat of a newborn versus a 1-year-old?
For a newborn, it's lower, so maybe like 35 beats per minute. It elevates by the time they're 1, obviously, so maybe like 40, 50, 45.
Okay, I'm ready to make an elimination.
I'm ready to, yeah.
Okay.
Doctor number 5.
Talked about the heartbeat for a baby. That gave it away.
She answered that a resting heart rate of a fetus or infant is 35, which it'd be very concerning if it was that. They'd be not alive.
Okay.
What? I would have got that wrong. I wouldn't know what to say. Well, 35 beats per minute, that's pretty quick. You know.
Demonstration. I was just gonna have Dr. number 6 do a little eye exam with my pen light on Andre.
Okay.
And tell us what she's looking for.
Let's see what Dr. number 6 got. She'll probably know.
See those skills in action.
Alright, so first I'm going to be checking to see if your pupils are equally responsive to light, and if they are equal in terms of size. I'm going to do the direct response first, so just look straight ahead for me, please. Cool, so when I shine it between the two eyes, I'm looking to see if the other one stays constricted, because that means that there's like a good communication between like the brain. So that's what I'm looking for.
Okay, Dr. number 1. Can you tell me what medication you typically prescribe to patients with cystic acne?
Yes, so if the acne is bad enough, we're gonna put them on Accutane, but that is a high-risk drug, so we have to make sure that the women.
I heard of Accutane. I mean, this she sounds like I said, she's in the medical field. Like if the last girl's not the doctor, then she's the doctor.
Come in.
It's between them
and
two.
give us a pregnancy test. And then I also recommend to not drink very much when you're on that medication, and that goes for men as well.
Last thing, does a bar of soap clean the face pretty well?
It can, yes. I have some patients that don't even use soap when they wash their face, and they have beautiful skin, so it kind of just depends on your physiology.
Thank you.
We're locking in the real deal.
Doctor number 6, What is that machine called that blows air into your eye?
Yeah, so that's called it's a non-contact tonometer. It measures your eye pressure to screen for conditions like glaucoma.
The cones that are in our eye, what do they do?
So they help you perceive color.
What colors do we see?
Okay, sorry, I'm trying to think.
Don't
Red, green, and yellow.
don't let me down. I don't know.
Talk me through intubating someone. What are you trying not to accidentally push it down instead?
You're not trying to push out the tongue so that they don't or it doesn't block the airway.
Okay. I'm gonna ask one more question real
Okay.
quick to doctor number one. Somebody has a mole. They want to get it checked out. What are some things they should look out for?
So changes in
Look, I'm not even a doctor. I'm just gonna make it up right now. You're gonna look for something that's not asymmetrical, something that's bigger than a pencil, the size of a pencil, and the discoloration if it's really dark. And I'm just throwing that out. I'm just making it up, a little bit of bit up. Let's see if I'm correct.
in shape, color, if there's any pain, that's definitely something we want to know. And then throughout the mole, if there is different kinds of colors and textures, that's something that we want to look at as well.
That is all I needed.
One of you is a real doctor. The other 5 of you are going to jail for impersonating a doctor.
Well, number one seems like she got all the answers correct, so it could be her. But I'm still gonna go with number 6.
Those doctors look really nice, Jason.
They really do. When Dr. Neela, co-founder of Janu, put on her first pair of scrubs, she felt deflated. The epoxy,
I am
baggy
gonna
fit
fast
really
forward
did not
this.
inspire.
But like she said, she's not in the biz. We think she was knowledgeable about every dermatologist. We think she was knowledgeable about everything that she explained. She didn't really know the jewels, but like she said, she's not in the ER very often.
We think the real deal is doctor number 1.
Oh.
She didn't fumble on any of her answers, and the more that she kind of got into it, the more I felt that like she was a doctor talking to me as a patient.
In the event that both teams lock in the real deal, the team that locked in their guess first wins.
If the lights on the floor turn green, that means that you have chosen the real deal. If they turn red, that means that you have chosen an imposter.
Red.
The real deal will be revealed in 3, 2, 1.
Ah, yes. It's number 6, or the last one. I was
Yes.
right.
Hello teams, my name is Rebecca. I am not a doctor. I was in the medical field.
I knew
My
it.
original plan was to be a PA, but then I left medicine. I went and got my MBA, and now I'm in marketing.
See, I knew she was really knowledgeable. That's why I knew she was prior medical industry or field.
I stopped working in healthcare 4 years ago, so it was a bit of a memory kind of situation. I was an MA for dermatology and plastic surgery, private office.
Because you're not able
And even I got the answer correct about the mole. I mean, that's just common knowledge. They should have asked her something harder.
to find the real deal, we will reveal them to you.
I'm a freaking I'm a genius. You're gonna think that I cheated and I watched this video.
Right there.
I should have gone
And she's probably Filipino. Like I swear, like the Asians are in the medical field. Like I live next to we have like a giant hospital right here, UTMB, and I used to work at the hospital, and everywhere I go, it's just like women and Asians just make up the medical field. Not just here, but pretty much all over the world. It's a thing.
Hi, I'm Nicole, and I'm the real doctor. I think sometimes maybe the way I speak can come off a little ditzy. I don't know if it's just my own persona with myself, but I feel like some people don't really look at me and assume that I could be a doctor. I think that doctor number 1 did an amazing job.
Yeah.
I literally would go to her.
I was not expecting the medical fans to come in like so hot with those medical questions.
Yeah.
So they
All right. I love that show. I'm glad I got it right again. All right, I'm gonna probably do a couple more videos before I go to bed. Like again, this is gonna be my new thing. Just doing reaction videos. Hopefully you like them. If you do, subscribe, comment, give me some tips. So I can grow this channel. All right, till next time.